What happens when you don't see your period for a very long time? The complication, the dangers of not seeing your period, and then what to do. Does merit I've not seen my period for 7 months and I'm not pregnant. We're going to be talking about what happens when you don't see your period, the complications, the side effects, what it does to you as a woman. Also, this video is in two parts. Basically, I'll be attaching reasons why you are not seeing your period. So after watching this, you will also watch the video is attached. Okay, so it's two videos in one. Now, please listen attentively. I've mentioned the reasons on my previous video on why you may find it, why you may miss your period, the reasons why you may miss your period. Please make sure you watch that video so that you will understand. If you don't see your period for this month, I've said it that missing your period 1 week is not enough for you to be scared. 2 weeks, 3 weeks, 1 month. But once it has past 1 month, please see a doctor. Now, missing your period for months, this is called secondary amenorrhea, right? There's primary amenorrhea where people have not seen their period forever. They've not seen their period. So if you're a woman, a lady, and you're up to 15 years and you've not seen your period, please see a doctor. Okay, now if you stay that long for not more than 2 months, for 1 month not seeing your period, over time, these are what is going to happen to the person. Number one, you are at risk of developing endometrial cancer. Now, every month, your uterus, is being prepared, thinking that they will be fertilized. There's a lot of blood supply preparing your womb so that if fertilization occurs, it can attach safely. If you didn't get pregnant, what happens is there are some hormones that are being produced, and then the walls of your endometrial layer shed off, and that shedding of its blood comes in form of your menses. Now, 1 month, 2 months is building up. The wall is becoming thick. There's no shedding. It's becoming thick. 3 months, 4 months, it's not shedding off. Okay, there's no blood coming out. What it does is over time you are at risk of getting endometrial cancer because it has thickened, and even endometriosis, it has thickened so much. Please, if you're not seeing your period, I'm going to tell you what to do at the end of the day. Secondly, your risk of developing osteoporosis and heart issues, where in the case of osteoporosis, your legs, because of the lack of estrogen, your bones become brittle. They can break easily. Okay, and some heart problems, diabetes, heart issues. Okay, now infertility, okay, and pregnancy problems. In the case of you're not ovulating, you're not seeing your period, you may have infertility problem and hormonal issues. Okay, when you get pregnant, you keep having miscarriages. If you keep having miscarriages, locate the video on miscarriage on my YouTube channel. I explain why this happens and what to do. So the next thing, miscarriages, have issues conceiving. Now, what you need to do is, I know you want me to give you drug. I can't give you drug. When you go to a doctor, what he does, a gynecologist, what he does is he prescribes a drug for you that can, after checking what is causing you, he prescribes a drug that can force the period out. Okay, force it out for then give you a drug that will balance your hormone depending on what is causing yours. Now, go and find out the reasons why your period is missing. Watch that video. Share this video so that women will not take it lightly. When you miss your period, you don't need to take it lightly. And of course, you will be scared. This is one of the complications because you will be scared. Okay, my name is Nurse Mate. I'm a nephrology nurse. Basically, everything about your kidney is my specialty. So have questions on that, drop them. And on my YouTube channel, I have videos, all the things you want to learn. The videos are already there, so I suggest you just go there and watch it. Drugs to take for missed periods. Now, this lady is asking the drugs she should take because she has missed her period, and I've been having similar questions as this. I'm going to tell you why you may miss your period and then what to do. Please listen attentively. Now, it's very important to note that if you miss your period, there's no cause of an alarm if you've just missed your period for some days, 3 days, 5 days, 7 days, 1 week, 2 weeks. it does not come cause for an alarm. Okay, because most of the times this could be even 1 month. This could be one because you tested too early. You may be pregnant, but you tested too early. Okay. The next thing may be because it's an invalid pregnancy result. So test. So usually you have to hold on, chill for until a month. After a month, if you missed your period after a month, I suggest you should go see a gynecologist. Okay. However, these are the causes, these are the reasons why you may miss your period, which will now tell you what to do. Number one, ruling out pregnancy, which if you checked is not it, you wait for a month. Number two, some oral contraception, those that you took contraception during the month, emergency contraception, post pill, and all of those. Depo-provera, people that has progestin, this can make you miss your period. Most people 3-4 months they've not seen their period. Okay, so this can make you miss your period, and you added a lot of weight or you gained a lot of weight. You're stressed. Okay. The next thing that can cause this is infection. As little as this infection can make you miss your period. Okay. The next thing is, meanwhile, if you want to treat yeast infection and you're having recurrent bacterial vaginosis, your vagina is smelling, everything about yeast, please DM Sentiment Essentials. I'm tagging them. Just DM them. They have what to give you. They have things that actually work. Okay. Please DM them and get yours. So gonorrhea, pelvic inflammatory disease can cause you to miss your period. Okay, so please treat infections. If you notice you're having infections, please, the Sentiment Essentials, they don't treat sexual transmitted infection. It's just bacterial vaginosis and yeast infection, okay, that they treat. So make sure you treat yourself. Then the next thing that can make you miss your period, PCOS, polycystic ovarian syndrome, which I have the videos on my YouTube channel. I have the videos here too, so you should watch them. Hormonal imbalance, I have that video. Please make sure you watch that video. Locate it here and make sure you watch the full video. And exercising too much. You did high intensity exercise over the month, this can make you miss your period. Okay, it's alcohol, smoking. Okay, you had a ectopic pregnancy before, okay, or you had an abortion before, this can make your period will change. Kind of, there's some medications that you're in, antipsychotic, anti-diabetic, you have diabetes, you have chronic diseases, you have kidney issues, you have diabetes, high blood pressure. This can alter your period. So all you need to do at the end of the day is to please, after 1 month you've not seen your period, please see a doctor. Go and see a gynecologist. I'm not supposed to tell you to take concussion, because if you do, you may be having cysts. Okay, you may be having ovarian cysts, and this concussion, cloves, and all of those things, which are good, but they may burst your cyst. Okay, they may cause more harm than good. So this is best, and probably what is causing yours is very easy. So usually they could the gynecologist will just prescribe maybe a 3-month drug or just a drug depending on what is causing yours. So please don't allow yourself to miss your period for more than 1 month. Okay, there is a bad effect on that. I have done that video already. Okay, please, so like this video. Our next video will be talking about breast discharge if you're not pregnant and what to do. Like this video, share and follow for more. Bye.